All right, and we're live on Facebook. Thank you so much, guys, for joining me on Facebook. Please take a moment and share with all of your friends because y'all are going to get the good today. This is from Duval's favorite doctors, Dr. Shashella Johnson Foy. Everybody knows Dr. Shashella, Dr. Letitia Jefferson of the Carithers Pediatric Practice. Everybody knows Dr. Letitia and Dr. Wesley Mills. Y'all already know. So we're going to bring the information to the people. Y'all know this is Millicent Daniels with Bad Standards Law, the people's attorney. So we're here to answer all of your questions. Please take a moment to share. Don't be stingy. Don't be greedy. We've got to get this information to the people. So take a moment. Go ahead and share out to your friends so they can get this good today. Get your questions answered from not the news, not the media, not your neighbor, not your pastor, but an actual doctor who can give you subject matter expert advice on what to do with this COVID. Is it safe or is it not safe? Mask versus not mask, social distancing. What does that mean? Does it really help? What do we do with our kids? So let's go ahead and get this party started. Doctor, let's lead out with Dr. Shashella. Go ahead and give us a little bit of information.
So, hi, everybody. Thank you for having me here and being a part of this wonderful panel. This is an extremely important issue. And the problem is that we're living in a time now where we're learning as we go. So this COVID-19, just to clarify, yes, coronavirus is a virus that's been around a long time, but are there several types that are out there, but it changes. There's different ways that it presents. And so this year or the end of last year, which is why it's called COVID-19, we were introduced to a virus that the public had not really seen. And there's a lot of, I guess, information or questions around where it came from. Recently, there was some evidence actually pushed today from some scientists who were hoping to debunk the idea that it was something that was made in a laboratory and that was released from the Chinese government or from the Chinese laboratory, and that it was something that appears to have been naturally occurring. Just like many of the viruses that we are faced with every year are naturally occurring. But because most of the time it's something that our bodies have been introduced to, or we have some type of immunity to it. But with this is brand new. And so because of that, that makes it highly contagious, more spreadable. And so it has created this global pandemic that we're trying to figure out how to deal with. With that being said, you've seen how this transmission has quickly spread from China to Italy to France to the US. And now we're dealing with a pandemic in the United States that is killing people. And the last time I looked, I didn't get to look at it today, but we were up over 45,000 people who had died in just a matter of a couple of months. And when you look at that in comparison to the flu, we usually see about 33,000 deaths a year on average. So we're already way above that just in the United States. So now we're faced with, how do we slow this down? What do we do to stop the spread? And that's where your questions about, do we wear a mask or not wear masks? Do we wear gloves or not wear gloves? How do we approach it? And that's what this panel is about, is trying to really answer some of these questions. So I don't want to talk. I know that we have a lot of panelists, so I hope that gave a brief introduction to why this is an important conversation.
Dr. Shashella, can you tell us, what is this just as bad as the flu, or, what's your medical opinion on that?
So when we talk about the flu, so the flu has a less than 1% mortality rate. Right now, globally, based on the last statistics that I saw, we're at about a 6% mortality rate for COVID-19. So when you think about that, if you think about it in the context of 100 people, that means that with the flu, less than one person dies. But if you looked at 100 people who get exposed to the COVID-19 virus, then at least 6 or 7 of those people are going to die. And in some places, it's up to 12%. So the mortality rate is fluctuating all over the place. Now, the thing about the mortality rate that we have to question just a little bit is that there are a lot of asymptomatic people
What
around.
does that mean? I hear that
Meaning,
term asymptomatic. I mean, what does that really mean?
so usually when you're really sick, you're going to have fever, cough, feel short of breath, feel like you're ill, muscle aches, things that feel very similar to the flu. Other people have no symptoms at all. They are, living their life, walking through the grocery stores, sitting in restaurants, doing things that they would normally do, and they feel just fine. But when they talk, they spread the virus. When they laugh, they spread the virus. When they do anything that releases respiratory droplets, they spread the virus. And so those are your asymptomatic people that we aren't measuring when we look at mortality rate. And so because of that, we don't really know what the true mortality rate is. But of those we can count, the mortality rate seems to be much higher than some of the other more deadly viruses that have presented themselves, like SARS and MERS, that we saw in the last year. So this has been one that has really shaken everything globally.
And this is for all of the doctors, and thank you so much, Dr. Costello. This is a big thing that I've heard on the news, and I've read a lot of articles on it, but doctors, weigh in on this. Is, what does it mean for us as African Americans? I've heard people talk about the fact that it disproportionately affects African Americans and people of color. Number one, is that true? And then number two, why is that? And then number three, what can we do about it? So let's start, Dr. West. Can you go ahead and weigh that in? Really disproportionately affecting
Milson, I'm sorry, I'm having trouble hearing you really well. It's breaking up, so I couldn't really hear your question very well.
So her question is, how is it affecting people of color?
Oh, okay. Thank you. So you guys, the problem is just like what Trishella said, with us, this thing is deadly as it is. So with us, there are a lot of factors that play into, healthcare with us in general. Healthcare disparities, which may mean maybe we don't get the access to the best care, or we don't have the insurance that we need, or provider bias when we go to the doctor. Maybe people aren't really listening to what we're saying. So that's part of it. On top of that, there are certain risk factors that play a role in, some of these deaths that we see in general from COVID. So if you have a lot of chronic illnesses, which unfortunately in some of our populations, we have a lot of diabetes. We may have a lot of high blood pressure or hypertension that can cause problems. So there are other risk factors, obviously. People who are immunocompromised, HIV, going through cancer treatment. But overall, the main problem is that if we're already behind as far as healthcare disparities. So if our healthcare is subpar to begin with, when we get sick, instead of just having a minor illness, we may die. So that's really one of the major problems that happens with, our community.
I can't hear.
Your volume is completely gone. So while we're waiting for Millicent, you guys,
Yeah.
Dr. Jefferson, why don't you go ahead and kind of tell us about how this is affecting the pediatric community and what things we should be worried about and looking out for?
Absolutely. So kind of piggybacking off our discussion earlier about asymptomatic carriers, children are typically presenting with very few symptoms or might present just with mild upper respiratory illness like cough, runny nose, mild fever, maybe diarrhea, but are pretty much having a much less severe course than our adult counterparts. Very few mortalities have been reported, and so it may just present like a regular URI. That being said, it makes it a little tricky trying to decipher between the COVID-19 versus the other many viral illnesses that these children present with. So we are definitely encouraging practicing safe distancing, and also are encouraging parents to, continue to provide the supportive care that they would normally do for any viral illness. Of course, if your child were to take a turn for the worse and start developing shortness of breath or have a known COVID-19 exposure, we definitely would want them to get promptly seen and evaluated. I think most practices, including mine, are making a lot of changes within the office to help get children seen, because children are going to be coming in with several different things, strep throat, ear infections that need attention too, that may, that won't have anything to do with this virus. So we have decided in our office, we have practice. We actually have 2 offices. So we have one that's only devoted to sick children, so we can see those children in open air, and one for healthy, well children, so we can keep kids on their normal immunization schedule and things like that. I think the fear is the biggest thing that's really been affecting everyone. But I think from a pediatric perspective, there is a little bit of comfort knowing that children are faring a little bit better than our adult counterparts. And so we just have to do our part as far as safe distancing so that we can keep the more vulnerable population, like the grandparents and the immunocompromised population, safe.
I think that, and this is Trishella.
Okay.
I think that one of the things that people don't understand is, so when we talk about school closures and why that is something that is important, is based on the things that you just mentioned and that you just said, is that one, there's a lot of households, especially in our communities and minority communities, where there is multiple generations in the household. So you need children, parents, and grandparents. And because you have that dynamic, if you're sending children off to school and you're not sure who they're exposed to or not exposed to, and they're asymptomatic carriers, or they don't have symptoms, they're not having the sick symptoms that most people get, then they bring it home and they give it to grandma or grandpa or auntie
Absolutely.
or big ma, whoever is taking care of them. And that is where you run into real problems, because then you now have moved it from a population that can get the disease but doesn't really get as sick from it, to a population of people who are higher risk. And
Right.
so those higher risk people are people who have like diabetes and high blood pressure, who are immunocompromised. So things like lupus, things that we don't think of, sarcoidosis, things that are more prominent and really affecting our communities. You now have moved it from the schools into the home with this sick person, and now you've progressed the condition or progressed the disease to a point that now somebody may end up hospitalized and potentially die because somebody went to preschool or
Right.
the elementary school. So Millicent, we're still having some problems hearing, and so we don't want to mess up that. We want to make sure that this is an important conversation. So if you want to go ahead and we'll finish, we'll kind of go into the conversation. So Wes, have you noticed any challenges with any of your patients or people, friends that are either making this a more difficult circumstance, or things that people are doing to kind of help make sure that this pandemic doesn't spread more than it is?
Phil, that's a great question. I think the key is really with everyone just making sure we're doing just the basics. Social distancing, wearing your mask, hand sanitizer, washing your hands. Because we're always talking about flattening the curve, and so far in Jacksonville and Northeast Florida, we've been very, very, very blessed, because I thought it was going to be much, much worse than it's been so far, which is a great thing, because we're not having nearly as many deaths as we thought, or ICU hospitalizations, which is excellent. So at this point, when they're talking about flattening the curve, and I think this is a good point, we want to make sure everyone understands what they're really talking about is, so say you have 1,000 people who were diagnosed with and have COVID-19. Well, if those 1,000 people get COVID-19 in 2 weeks, that's going to put a huge burden over the healthcare system, because there's only there's a finite number of ICU beds, ventilators. We only have a certain amount of staff, doctors, nurses to take care of those patients. However, if you have that same 1,000 patients, that happens over a 6-month period of time, it completely changes things. So while you still have the same number of patients who were sick, you divide it up over a 6-month period of time. Now, what we're trying to do now, because we're trying to be more aggressive, is we don't want to just flatten the curve. We want to crust the curve. So which means, from the results we've seen from the social distancing, these numbers have gone down. So we don't just want to decrease the amount of people sick at one time. We want to decrease the number of overall people who are sick in general. And that's very, very important.
Right. I know that one of the challenges that I have had is the question about church. So let's really kind of get into the meat of some of these things. I had posted I had put on a Facebook post where I had interacted with someone. And of course, this has been an ongoing conversation. And this was really before any state of emergency orders had been called or anything. But I had someone who said that people were not being faithful enough, that they just needed to have faith and that God was going to see them through this, and they didn't need to worry about wearing masks and doing all of those things and not being around people. They just needed to stop living in fear. And so my comment at that point, I didn't comment because I respect people's opinions. And I felt like I needed to just ponder that a little bit more. And so luckily, I ran across an article where it showed in South Korea had, as you said, not only flattened the curve, but kind of crushed the curve for a little while. But then one woman who had what she thought was the sniffles and who she thought who she felt like she had a cold, didn't follow instructions, went to the doctor, and they tried to send her to the hospital. She didn't want to go to the hospital, so where did she go? She went to church because she felt that this was an opportune time for her. That was the part of her natural routine. Well, South Korea went from having no new infections to, in a matter of a week, having what appeared to be just from her simple church outing that she did 2 times over a matter of 2 days, ended up infecting 1,500 people just from that simple little outing. So it was in that context that I wanted people to understand that it is still extremely important that we make wise decisions. Have you guys had any of those challenges with patients, or what has been your instruction or guidance to maybe the religious community through all of this?
Dr. Justin, you want to go?
Well, not so specifically questions towards the religious community, but kind of especially in children, regards to children playing with their friends, missing the camaraderie of going to school, seeing grandparents. It's all been very difficult for everyone to kind of get adjusted to the new normal. I think we live in a great time where we have access to so much technology that we really need to utilize these different things to kind of stay connected to everybody. It's healthy, it keeps everyone safe, and it's good for everyone's mental health to see their grandparents, to know that everyone is still caring and taking care of each other despite the social distancing. I think right now people are really becoming more comfortable with these different modalities. As far as church goes, obviously, we have so many different platforms where people can still get their spirits nourished, but still do that safely. So I think really trying to encourage people to get creative and use technology to stay connected is what we've really been pushing with all of our patients, especially.
Doctors, it looks like we have a question here. Can you all hear me?
We can
Yeah,
hear
we can
you
hear
now.
you.
Yay!
God bless the Lord for it. We have a question from Lisa Askew, and thanks for joining us, Lisa. Fantastic questions. This is to Dr. Jefferson. Lisa asked, will NSAIDs like Advil, Motrin, aspirin, does it exacerbate the symptoms if you have COVID-19? Can you go ahead and answer that for us?
That's a great question. Initially, in some of the studies coming from overseas, there was concern that some anti-inflammatories such as Motrin and different NSAIDs could cause for a more severe course. Again, this is a novel virus. We're still learning things every day. Our practice standpoint, and from what we know, we're really encouraging people to try to utilize Tylenol over NSAIDs if possible, just in case you were to be exposed to the COVID-19, and there could be a little correlation there. However, we're not exclusively telling you to exclude the use of NSAIDs. So if that's all that you have, it's okay to utilize it, but we are trying to minimize the use of it just in case there could be a correlation with worsening disease. As we learn more, we will, adjust and change our recommendations. But for now, I would try to steer towards more Tylenol. But if that's all you have, then you can utilize Motrin as you need.
Great. Thank you so much for answering that question for us, Dr. Jefferson. And listen, Facebook family and friends, if you all have any questions, please post them. We're trying to bring the information to you. You don't have to call anybody. We're bringing Duval's doctors to you in your home on your Facebook Live to answer any questions that you have. So if y'all have any questions, just go ahead and post them, and we'll do our very best to make sure that each and every question is answered today. And thank you so much, Dr. Tristella, for leading the way. I know this discussion about our churches and places of worship is one of those hot button issues, especially in the African American community, because we love the Lord, but I know I'm not trying to see Jesus' face today or tomorrow. So I choose to worship virtually on the youth ministry. Now, let's talk about our elderly folks. What have y'all been seeing or better yet, we have another question by Jameer Baker Madden. And let's go ahead and pose this to Dr. West. Dr. West, Jameer Baker Madden asked this question, and thank you so much, Jameer, for joining us. What precautions can a person take with underlying illnesses such as asthma before returning to work?
Oh, excellent question. So one of the main things we want to make sure is that your asthma is well controlled, first of all, because that's going to be, so some of the problem, you guys, is not so much that you have these conditions like the diabetes or asthma or hypertension, but if they're poorly controlled, because if they're poorly controlled, that's what's really going to bring, place you at advanced risk for having severe, illness if you were to contract COVID-19. So before going back to work, obviously, you want to make sure your asthma is well controlled. And then you just want to make sure that you're able to, do the social distancing and just basically have everything in place so you can keep yourself as safe as possible in that work environment. To be able to stay 6 feet apart from someone, make sure you're wearing your mask, hand sanitizers as much as possible, washing your hands. But underlying, you want to make sure that your asthma is well controlled. And if that's not the case, make sure you get to see your primary care physician and your allergist or pulmonologist to make sure that they're getting that together for you, because that's the main problem if the asthma is poorly controlled.
Thank you so much, Dr. West. We have another question from A.B. Frazier, and thank you so much, A.B., for joining us this evening. For a person that has autoimmune disorders or disease, which mask do you all recommend is the best in order to protect themselves? We've heard a lot about KN95, N95. Some people have been talking about just put a cloth over your face. What's best? What do you all recommend?
The ones you can get your hands on.
Right.
Right now, there's a shortage of personal protective equipment that for our healthcare providers. But there are some people who have access to it outside of the health community. And so the best thing for us is the N95 mask. However, at this point, the CDC is recommending that any kind of cloth covering, if you can get a mask with a filter, that's good. But if not, you can make a mask, and there is some validity to it. The idea is to block any respials that you may be putting forward to society, and then to block anything that may be coming towards you. So really, it's the biggest thing about the mask is for the sickest people, the people who are who we know are symptomatic. We want to make sure that we're protecting ourselves from them. And again, the people who aren't symptomatic, the people who don't have any symptoms, when they're talking to you standing 6 feet away, they can still make you sick. So the cloth covering, making sure that your nose and mouth are covered, are thought by the CDC, the Center of Disease Control, to be good enough to provide some protection. So, but at this point, I wouldn't try to stock up on just like the N95s and the KN95s, because those things actually are in shortage for our healthcare workers. So if we can try to honestly allow for the people who need it the most to get it, then I would recommend that. And then you do the masks that you have better access to. But professional masks need to be for our healthcare providers, please.
Thank you, Dr. Shoshella. We also have another question here. And guys, these are fantastic questions. This is wonderful. Miss Rosetta Watson asks a fantastic question. Is it okay to go to the beauty parlor or salon if they wear gloves and if they have a mask? Is it safe?
Now, I hate to be the one that keeps talking, but I happen to own a beauty shop and a barber salon. My husband's a barber. Hey, Lamont. I want to say, and Wes doesn't have much hair, so I think we'll leave this one to me. And Dr. Jefferson. So, no, you should not be going to the beauty salon and barbershop right now while we have the stay-at-home order, the shelter-in-place order. And that means that you're going to have to be creative with what you do for your hair. Once we start moving back and some of the sanctions are lifted, you're going to want to be wise and smart as you start going back to any business. There are things that you can do. Let your stylist or barber know that you are in the car and outside. So sitting in your car as opposed to the waiting room when it's time to go back in, once we are really moving back towards it. But right now, it is not the safest thing to do. Right now, you should be social distancing, and it's hard to social distance from your stylist or barber. When my husband is thinking about his clients, he's not just thinking about what they can potentially bring to him. I'm a healthcare provider and he's exposed to me, and he knows that there may be things that are coming in our home from outside. And so we try to do our due diligence with staying protected. However, he doesn't want to take anything from inside our house out to his clients. And so he's been unfortunately having to try to really explain that to people that, look, we're trying to keep you safe. We're trying to make sure that you're covered and that we do the best we can. Yeah, I just scratched my face. We're trying to make sure that we do what we can to really, as Dr. West said, really just expunge this virus. And the best way to do that is to continue to stay socially distant. Now, when this is over, y'all welcome in the Platinum Cut Barbershop and Salon. But for now, stay home. Look at a YouTube tutorial. Figure out how to do it yourself.
Thank you so much, Dr. Shoshella. We have another question from Samuel Flagg. What do y'all think is one of the biggest challenges for us in opening our communities back open to the public? What's one of the biggest challenges that we have with opening up our communities to the public? Now, I know that's a broad question, but go ahead and shed some light on this. What are y'all thinking? Is it premature?
Everyone's looking at Georgia, and I think South Carolina as well, and maybe Texas. We're afraid that because part of the problem is, while we see these numbers, but we're not testing everybody either. We're really only testing mostly symptomatic patients. So like Trishella said earlier, there's a lot of asymptomatic people because, again, we only started testing in March. And we know this has been around. I think the first case was maybe in California in like late January. So, people were coming to see us possibly, in February and even early mid-March. And we didn't, we weren't thinking about, COVID-19. So if they didn't have influenza, we might have just thought they had another type of virus. And so, and those patients have, cleared the virus now. But, the question is, how long are you symptomatic? So there's a lot of asymptomatic patients, and we're not testing, we're not doing the antibody test widespread right now because, again, a lot of us could have already had this. And since we haven't done the antibody test to check and say that, hey, you've had this, it's hard to tell. So if we start to open this up to everyone, just like Trishella said with the example of the patient in, I think she said Taiwan, going to church, all of a sudden these numbers that look really good, all of a sudden spike back up. And then you have wave 2, and then that's going to make it even, it's going to take us even longer to get back to whatever the new normal is.
I think one of my concerns as well is that we haven't developed a rapid test right now. So, we're still waiting several days to find out if your URI symptoms are truly COVID-19. So with us knowing that the incubation period can be up to 14 days, there's a lot of people who are asymptomatic right now who are at home and feel fine. And if we open everything up and everyone just goes to all the places that they've been missing, where it's going to be easy to spread that very rapidly, and there's not really a great way to test it quickly to really be able to quarantine as we should be able to do if you were to test positive. So I really am concerned about opening up a lot of public places rapidly without having the ability to have a rapid test.
Good feedback, good feedback, good feedback. It looks like we have another question here, and this is from Ms. Shirley Childs, and her question is, this is a little bit technical. Should hospitals in Florida continue to decrease their outpatient clinic appointments flow? Should hospitals in Florida continue to decrease their outpatient clinic appointments flow? Now, you all are medical professionals. I'm sure you all can interpret what that means, but can you shed a little bit of light on what on something, an answer to that for Ms. Shirley?
So one of the things that, again, the same as church, there has been opportunities to advance how we take care of patients. So at this point, most clinics and most medical facilities have really started, the flow is no longer needing to be decreased because we have the ability to do virtual appointments, which means either through the phone or through the computer. The insurance industry, this technology has been around for a long time, and most of us have been trying to get there. What has happened is that COVID-19 has really propelled us forward so that the insurance companies, which we have had to previously fight with to pay for these types of visits, are now opening it up because they also want to make sure that their consumers and patients are taken care of. So now they're allowing us to do virtual visits a lot more. I know that here at Baptist, all of our clinics are doing virtual visits. We're doing about 80% of patients either through the telephone or through the computer or some type of device that allows us to see them, do some sort of exam, and to make sure that they're taken care of. We bring very few patients into the office because at this point we're trying to still keep patients safe. But we are also now moving more towards, instead of expecting a big surge, which was what we were thinking was, or what would have happened if we had not done our due diligence with social distancing, there would have been an overwhelming number of people that were sick and affecting the hospitals and doctors' offices. But now that we have been able to flatten the curve and we have these new technologies to take care of people, if we just spend a couple more months really doing our due diligence, keeping people out of the office or safe from each other, we'll be able to open it up a little bit more where people come into the offices. But telemedicine is not going anywhere. It's here to stay. It's just a matter of really knowing whether or not the insurers, once this has settled down a little bit, are still going to allow the consumers or patients that are us to really continue to have these types of appointments. So you guys make a lot of noise, tell them that, hey, we like this whole virtual visit thing, and we want our doctors to be able to take care of this way as well, but keeping it as an option to still seeing patients in the office, because there's nothing like that touch that we need to diagnose certain things. So.
Thank you so much, Dr. Shella. We have another question from Ms. Jamia Baker-Batten. She's joining us this evening. Thank you so much for joining us, Jamia. Now, this is a common question. I know I sit in the house and I'm like, I just want to break free. She asks, what's a good way to deal with anxiety after being in the house for weeks? What's a good way to deal with anxiety after being in the house for weeks? Y'all jump in.
I would say, being a sports medicine guy, I would definitely say exercise is a great one to definitely help out. Because you just need something to break up the monotony, and obviously exercise is going to be good for you regardless. So whether that be doing something in the house, you can pull up a video and do some beach body or whatever exercise you want to do, or pull up something or online. If you have a Peloton bike or a run in place, even if you can get outside. I mean, because you can definitely do social distancing by exercising outside. You don't have to be really close to people. If you want to go for a walk or run, all those things are great ways to get out of the house, and and just to kind of deal with the anxiety.
And I also talked about this a little bit earlier, but making sure to connect with your friends, connect with your family. We have a lot of elderly people who are, lonely. They're missing their grandchildren. So take that opportunity to connect with them. Don't have your Zoom parties. And, we've been seeing lots of creative ways on social media that people are still celebrating those milestones that are happening while we're in quarantine. So, get creative. Journaling has been very, helpful for a lot of people. Writing down your feelings, seeing your thoughts now so you can look back, years to come and see where your mindset, was during this crazy time. But don't forget the personal connection with people, and don't feel isolated because we're all going through this together. So make sure you reach out to your community for support too.
When it comes to technology, by the way, one of the things that I would encourage you to do, so Dr. West and Dr. Jefferson have definitely said some excellent things. Primarily the fact that no, you can still go outside. Really being at the house doesn't mean being inside the house per se. If you're far enough away from some other quarters, take a walk. Whenever you're doing things and being active, that exercise releases what's called endorphins in your body, which is similar to smoking weed or other things that go to the happy centers of your brain. I'm telling the truth. Exercise. It will actually go to the happy center of your brain, just like a lot of those things that are illicit, and it can elevate your mood. And so exercise is a natural stimulant or elevator of the mood. And it doesn't have to be, oh, I'm about to go run 10 miles. It is take a walk. My family has actually, there's a little bridge near our house that's long enough for us to get some exercise, but also go out during the right time and we can enjoy the sunset while we're walking. Doing things that are really going to really keep the spirit up. If you have elderly members or members of your family that are not technologically advanced, just take a moment to help them do that. Set up their Duo or FaceTime for them. Do things that are going to allow them to stay connected as well, because we kind of feel like sometimes it's not worth the time that they're not interested, they don't want it. But the reality is they want to stay connected just like everyone else. So set up a little phone for them, or buy them a little iPad or something that is, you can get a generic brand iPad that doesn't cost very much, have it shipped to them, and then walk them through the setup for it. That way we all stay connected.
Thank you so much, Dr. Trishella. Go ahead, Dr. West.
No, I was just saying, I think we lost you for a second.
Having a few little technical difficulties. That's nothing but the devil trying to get in the way of getting the information to the people, but we're not gonna let the devil prevail today or any day. Anyway, nevertheless, Dr. Jefferson, what are some of the other common things that you're seeing within your practice area? I know you deal a lot with the little people. So tell us about that. If a parent suspects that their child is displaying symptoms that are conducive of COVID-19, what should a parent do? I mean, that's very difficult in a situation where you're dealing with a child. So what do you recommend? Go ahead, Dr. Jefferson. Can you hear me?
Don't think she heard you.
I can hear you. Wes, I can't hear. I didn't hear the question. Do you mind repeating it for me?
Yeah, she was saying, what do you
Go
do
ahead.
if you have a child who you think may have the who is not necessarily exposed, but is displaying symptoms of COVID-19? Like, what's the methods did you go about with those parents and with the children?
Absolutely. So we do have a screening process when you call to make an appointment at our office, so we can try to keep everyone as safe as possible. If you do have a true positive COVID-19 exposure, we will try to get you appropriate testing and direct you to the health departments and the appropriate testing centers so that we can get you tested, because unfortunately we don't have the capabilities to do that in our office quite yet. However, if there's no known exposure and your child isn't having any respiratory distress, we want to see those children. There's so many numerous viruses and other even bacterial illnesses that require antibiotics and other forms of treatment that we want to take care of. And I think that most offices have made strides to make a safe environment for it to see these sick children. If you, I think some offices, if they only have one location, are trying to see maybe sick children at the end of the day to try to provide a barrier from healthy children. We're fortunate where we have two separate offices, so we're actually seeing those sick children outside, actually at your car in open air, to help minimize exposure of our staff as well as other patients. So if your child is having upper respiratory symptoms or ear pain or sore throat or any other concerns, we still want to provide that care and we still want to see them. So it's important that they still get the appropriate care that they need. So I would encourage you to reach out to your pediatrician and still get them seen in a timely manner so they can get their right care. I can't hear you.
Can you all hear me? I'm sorry.
Okay.
Can you all hear me now?
Yes.
Can you hear me now? Okay, sorry about
Yeah,
that, guys.
that's okay.
Okay.
We can see the question, but we couldn't hear you.
Sorry about that. So we have another question from A.B. Frazier, and she asked a great question. Can animals contract the virus? I know I've seen a lot of stories about something about a lion contracting the virus at the New York Zoo. I've read something else about a cat contracting the virus. So is that true? And how is the virus being transmitted to animals?
We've only seen those couple cases, and maybe one, Trishella or Dr. Jefferson know a little bit more. But I mean, obviously, it's basically transmitted from respiratory droplets. So if we can get it from respiratory droplets, the same assumption that that's how the animals were able to contract it. Again, haven't seen it a lot, and then not like everyone's running around testing their animals for coronavirus. But that's what I would assume, just from just simply from being in close contact and those respiratory droplets.
Want to go ahead? So yeah, so there have been recently some cases, and actually today I was privy to it, and the CDC is now recommending that we kind of socially distance our pets. There were two new cases of two animals who actually tested positive, and then the tiger who tested positive. So yes, they are recommending. And the reason why this is happening, to get back to kind of your big question, is that this is how these things work. This is how the spread of viruses and infections oftentimes work, where there is, it can start out, and the thought is that this particular virus, COVID-19, is very similar to a bat that they were studying over in China, the genetic makeup of it is like 96% close to it. And the thought is that the bat likely bit or exposed another animal like a dog or a cat or the monkeys who were in the market in Wuhan, and that then those animals could spread it to humans. So viruses work like that often, where it starts in an animal population and then is transmitted to humans. That's why you had things like the bird flu and other viruses that we see all the time. There are some that we are fortunate do not show a animal to human transmission, and we're very fortunate about that because there are some things that can be very deadly. But then you have something like this that comes along where it does spread from animals to humans, and we end up with this type of global pandemic. You know, this isn't the first time the world has seen a pandemic, and that's why we've been blessed to have things like the influenza vaccine that allows us to, our body to develop some type of antibodies to it so that we don't get so sick every year. The biggest thing that is making this such a terrible virus is that it's novel or new, and we haven't had exposure to it. So the people who I fight with every year about being vaccinated for the influenza virus and other conditions, that's what the point of it is to, for your body to develop some immunity so that when stuff comes along, you don't get as sick as you would have before we had these vaccines. So this is why vaccination is important. And I know that opens up a whole nother can of worms. But vaccination is important, and people are now excited and waiting for the COVID-19 vaccine, but you weren't excited about the flu shot last year. So I want you to take that same enthusiasm and same thrust to know that don't just protect yourself from the things that scare the hell out of you because it is now this new thing, but take that same energy and protect yourself from the other things that we've discovered a long time ago that we can give immunity to, like the measles and the mumps and influenza and tetanus and polio, these things that are now resurging and that we're running into the possibilities of epidemics and pandemics because there's a lot of misinformation, absolute lies that have guided us on kind of what is a scare about vaccinating. Now, is it, the thing that we know and the thing that has been shown to be true is that the public health and the safety of the public health is much better when we vaccinate. And so make sure that you look at all of the vaccines that are available, all the ones that you need, and get them. Thank you.
Thank you, Dr. Trishella. We have another question, but Sherry Cooper poses, this is a great question, is are steam treatments recommended to kill the coronavirus? She hears that boiling water and adding oils, sea salt, lemon peels, etc., and breathing into the steam is a way to combat contraction of the virus. What do you all say about that?
Yeah,
No?
there's been no data that that's going to be shown to be, and that's part of the problem, you guys. We read all these things and you think these things are, possible cures and treatment, and they are not, and you can end up being deathly ill from this. So the key really is, if you thought you have, or if you think you have coronavirus, definitely contact your physician. And if your symptoms are thought to be, severe enough to need to go to the hospital or the emergency department, do that. But these treatments there's been no data to show those are, effective. In addition, this brings up a really, really great topic because you'll hear the president talking about, different medications. And I've gotten questions from patients regarding like Plaquenil or hydroxychloroquine or azithromycin or the Z-Pack, as people know it, for treatment. And there's a lot of ongoing studies, and some of them have been some anecdotal studies, which say, and that just basically means maybe Trishella and I saw some patients and we put them on it and they got better. So we're, letting other people know that it was beneficial. But when they're doing some randomized studies, they haven't been as, it doesn't look as promising with those. But again, these are smaller studies. So they're doing some larger studies in like China. So we'll kind of know a little bit more later. But another point with that is also that, people wanted, I had patients calling to say, can I get a Z-Pack or something to prevent coronavirus? And again, what we're looking at is treatment for the coronavirus. So we're hoping these things, if you have it and you've tested positive for it and you're ill, that those things would be treatment, but they're not preventative. That's an entirely different thing. So they wouldn't, even if you were taking it, it wouldn't prevent you from getting coronavirus. This would be treatment if you already contracted it and you were ill. So we were trying to treat it.
So, Dr. West, is there any merit to what people are saying as far as, and I know that I've read this in several different media outlets, is there any merit to this theory that drinking hot liquid somehow helps with not being able to contract the virus? Or is that just pure conjecture?
Pure conjecture. Yeah, it's another one that we've not seen any, medical data or scientific data behind that to prove that. So that's kind of what we want to tell people. If you think you're ill from coronavirus, definitely get tested and talk to your physician. Seek medical attention because these home remedies likely are not going to help at all.
Now, and very specifically, I'm sorry, Millicent, this is actually extremely important. The fact that the person asked specifically about steam treatments and breathing in steam, there is concern that we have as we are treating this virus, is that we don't want to do things that actually are aerosolized even more. So things like steam treatments are not quite recommended because there is the potential that the virus actually can flourish in that type of treatment and environment. So even my patients who have asthma or COPD, who normally would be doing nebulizer treatments or treatments where they breathe in their medicine, it's not recommended that they do that. It's recommended that if you have asthma, that you use what's called a spacer or an MDI, which is a little tube that you put on the end of your albuterol inhaler that allows the medication to get into your lungs more efficiently. But the goal is to not allow you to be sucking in and breathing in more air and things that actually could contain more of the virus. So from that context, it actually would be recommended against doing these steam treatments very specifically. Not just that it may not work because there isn't really any proof, but that you may be endangering yourself. So the things that you want to do, yes, keep your body healthy, keep your immune system healthy. So good vitamin C helps to, probably spark the immune system. There's anecdotal things about echinacea, but it's not specific to COVID-19. It's just about being healthy. So fruits and vegetables, the exercise that we're talking about, drinking lots of water, staying well hydrated, minimizing processed foods, a plant healthy diet is good for a lot of things. But then you also need to make sure you're having good protein so your muscles are strong. So a balanced, healthy diet is going to be important. Healthy things are going to be important, but not just steams and waxes and things that really haven't been proven and things that may potentially harm you more. Please don't do those.
Thank you, Dr. Shashella. We have a couple of more questions here. Casey Williams, he asked the question, and Dr. West, I think you touched on this about things that the president was spouting. He asked the question, so why is the president stating that doctors' offices can actually test for coronavirus? Can you help us reason with that?
Yeah, a couple of reasons. This is a really important point that we want to make sure, because you guys, it's not that we don't want to test you guys, but like Trishella said earlier, we don't have enough of the PPE, which means if we were to test someone in our office and we didn't positive, then basically we have to shut down the office for 2 weeks because we now need to be quarantined. And because we're trying to keep all the PPE in the hospitals and those acute settings where they really need them. So we've been trying to set up, and what we did at St. Vincent's probably about a month, 5-6 weeks ago, we decided that we didn't want to have the testing done in the office, but we were going to have them go through so we set up a drive-through testing over in one of the hospitals, and it was a parking lot, and they would go through, and once we talked to the patient and we deemed that they may have symptoms that were questionable for coronavirus, we would put the order in, and then they would get tested, outside and someone who had the PPE on. Because again, you want to make sure we're trying to keep everyone safe. Because if all your healthcare professionals get sick, there's no one to treat, our sick patients. So that's why we're really not trying to treat in the office, or not test in the office, I should say, because we don't have enough of the PPE to go around to make it safe.
So that appears to be another piece of misinformation that is being told to the American public. And thank you so much, Dr. West, for clearing that up for us. That makes a lot of sense. PPE, can you tell us what that is?
I'm sorry, guys. That's the so that would be if you guys were like the masks, you know, the N95 that we need or surgical masks. That would be the gowns, the gloves, and we just don't have enough of that to go around to protect ourselves, and that's why we're trying not to test in each individual office.
This is another question that Casey poses to us. Very good. He asked Dr. Mills, if you're due for an annual physical, should you proceed with trying to go ahead and go through with the regular appointment, or should you hold off? What's the protocol of your offices through here?
What we've been doing during this period of time, we've tried to put off all of the, you know, any preventative things that we can, because they're just kind of like how they stopped doing elective surgeries right now. The annual visits, we've tried to put them off a little bit until this calms down. Because again, we don't want to put people at increased risk for things that are just elective. So obviously if you're really sick, and like Michelle said, we're also able to do the virtual visits. Unfortunately, some things you probably have to see the patient, because again, we need to listen to you, or if there's something going, depending on what the problem is, we may have to do an actual examination on you. But we can do a lot of things over the phone. But as far as the annual physicals and other preventive maintenance examinations, we're trying to hold off on those right now, because, you know, we just don't want to put anybody at increased risk.
And also, very specifically, a lot of insurance companies won't really pay for that. So we don't want you during this time of economic hardship and crisis to end up with any bills that are unnecessary. So that's another reason why the physicals we can hold off a little bit on. You know, we only want you to come in the office if it's absolutely necessary. And so, and your physical are those preventative things. And so that's why it's important to, you know, try to make sure you stay on top of that every year. So if during these 2 or 3 months that we are on sheltering in and not doing our physicals in the office, or out, not allowing people to come to the office right now, you're still up to date on your preventative stuff. So this is kind of a lesson for the future. You know, let's not wait until we get in crisis mode to start trying to take care of ourselves. And Mr. Williams sounds like someone, the fact that he even brought this up, who would normally go in for his physical. So you want to encourage everybody to really do that, because if ever then there's a time where we have to really shelter in place longer, you'll have an idea of what your general health is, and you'll know that you're protected. You'll have had your proper immunizations and all those things that you need to make sure that you can make it through these couple of months of not being able to go into your doctor for an actual quote unquote physical.
To add on to that, from a pediatric standpoint, I really would encourage you to reach out to your pediatrician and see what measures they've taken in place to keep their office safe, because the CDC is recommending that, as we've talked about before, it's really important to stay up to date on those vaccinations, especially in children up to age 2. You know, we're typically seeing your baby every 2 to 3 months for the first 2 years of life, and they're receiving vaccines very frequently. So to decrease the, you know, rise of a different pandemic like measles, chickenpox, or something like that, it is really important that your children stay on a pretty timely vaccination schedule. So I think that, again, a lot of practices have different ways they're handling this. In our office, we have just one office dedicated only for healthy children who are coming for their well checkups, so we can get these babies seen, and we can keep everyone vaccinated appropriately. So keep that in mind for your little ones.
Yes, I'm sorry. So I want to say, yeah, and Baptist is doing the same thing. So that conversation about annual physicals is really about adults.
Right.
You know, the children should still be going in for their physicals, and to have a setup like that, like Carruthers has and that Baptist has, and I'm sure St. Vincent's is doing something similar. You want to still make sure those children are being vaccinated, because
Absolutely.
she said it perfectly. We don't want a different kind of pandemic. Oh, Millicent, we can't hear you again.
I'm sorry, guys. I'm sorry, guys. Just to round out our questions for this evening, we just have a couple of more. And thank you so much, doctors, for your time. Ms. Stefana Biggins asked a very good question. She's heard different explanations on elective surgery. So there's a misconception that all elective surgeries are related to plastic surgery and not preventative procedures. Can you all elaborate on exactly what elective surgery means?
Yeah, do you want, I can take that, Wes, if you like. So elective just means that it's not an emergency right now. The elective surgery would be, so let's say Aunt Sue was set for a knee replacement because her knees have been hurting for 25 years and she finally decided to go ahead with it. Well, that would be a surgery that would be put on hold because there's no due risk to her right now to hold off on it for a couple of months. Now, if she got in a car accident and she broke her hip through that, that's an immediate need. That means that knee surgery or hip surgery would take place. And so it's not about plastic. It's not about things that you are doing to beautify yourself. It's about any procedure that is not considered or deemed life-saving right now, or going to really, if you don't have it, cause any undue or any long-lasting harm. So there are things like I can't do. So for instance, some of my patients, because as we know, there's probably going to be a lot of corona babies. The things like I do Nexplanons and IUDs, and these will help prevent pregnancy. Well, right now, we can't do those because those are considered elective procedures. And so because of that, I can't wait till 9 months from now. I'm sorry, ladies. I tried, but the governor said no.
You know what? That brings us to a great question. Can you get the disease via sex?
Doctor, oh, I'm sorry. I'm still a media. Okay. I was trying not to be the only person talking. Dr. Mills I think, was going to say yes. So, Dr. Mills, you want to elaborate on that? Okay. So, any type of touch, any type of touching, close proximity, if we can get it touching each other's hand in the grocery store, of course we can get it through sex. So yes, absolutely. You can get it through sex. Now, is it a sexually transmitted disease like the other creepy crawly stuff? No. But it is something that you can get from talking to someone in their face, from being
Right.
within 6 feet. So unless you can manage to do that 6 feet apart, then yes.
Yes, indeed. Yes, indeed. Thank you, Dr. Trishella. We have another one from Jakara Doyle. She's asking the question, pretty much she's asking, can you catch it? If you've had it, can you get it again? If you've had the disease, you recovered, of course. Can you get it again? Can you contract it again?
I'm not. I don't know if we're completely sure about that yet, because this is like you said, this is a novel thing. Now, what we are trying to do is, because we haven't tested a lot of people for these antibodies, which is what would tell us if you've had it. And there's two types they'd be checking for. There's one called, don't want to get too technical, but there's IgM and IgG, and one tells us if you have it right now or it's an acute thing, or the other one tells us if you've had it previously. So, and that's really what we're going to need to do to test a lot to kind of open everything back up. That would help tremendously, along with increasing the number of even asymptomatic patients that we're testing, because that's really what's going to help open everything up. You got testing, but that's a whole other issue. But the antibody test, what it does, would tell you if you've had the illness already, and have recovered from it. And depending on which one of the antibodies that's testing positive, will tell us, where you are in that whole phase.
Thank you. Thank you. And we're winding up here. And listen, guys, if we don't have an opportunity to answer all of your questions, please just drop the question in your comments and we'll make sure that we get your questions answered, because this is about getting the information to the people. We're trying to make sure that you get accurate, correct information from some of our best and brightest here in Duval County, Dr. Tristella Johnson Floyd, Dr. Wesley Mills, and Dr. Letitia Jefferson. Thank you so much, Jakara, for the question. Excellent, excellent. We have another one here. This is from Miss Mrs. D. And she asked the question, is it true that the CDC has changed the guidelines about the timeline that you have to quarantine from 14 days to 7 days if you've tested positive? Y'all can jump in.
Yeah, yes. Wait. Go ahead, Wes.
Oh, I was gonna say, go ahead, Phil. I don't want to keep talking.
So the answer is there has been an adjustment in the quarantine guidelines, and I don't want to tell you a lie and misquote them, but there's been a recommendation, and it's not just a matter of 14 days to 7 days. It's about what symptoms you have or don't have. It's about how long you've been fever free. And so I can get that for you in just a second so I can tell you the specifics because it's changing so much that we don't necessarily have it at our fingertips. So when I have a question, I go back to what the CDC website shows me and what the guidelines of my clinic. Now, what you'll learn is that your employer, however, may have a different guideline, what the CDC says. And so if you do end up getting the virus and you're someone who's still in the workforce, you want to really know what the specific guidelines from your job is. So for instance, I have a patient who tested positive, and for them, their job is saying they can't come back to work for 21 days, which is beyond the guidelines of the CDC. Whereas I've had others who said you need to have at least 2 negative tests for the coronavirus before you come back from after you've been quarantined if you had a positive test. There are other employers who have said, well, you don't necessarily need a negative test result, but you need to have been quarantined for 14 days and your doctor feels like it's okay for you to return. So the CDC guidelines and recommendations are one thing, but you really want to learn what is specific to you and your employer and go from there. Now, when you come to, well, when can I come around people again? When can I let people in my house, or when can I go to the grocery store again? Then that would be maintaining those CDC guidelines and making sure that you try to stay put from anyone. And I did get a question today from someone about who is under quarantine about, can they walk around their neighborhood? And so the answer to that was no, not when you are in actual quarantine and we know that you actually have the condition. When we know that you actually have tested positive, that means you are infectious. And we don't know how long you're going to be infectious. We haven't really hammered that out yet. So until we are able to feel like you're truly past the infectious point, and that'll be determined by you and your clinician, then you need to really stay put. You need to learn how to cook good. You need to learn how to clean your own house, do all the things that you would normally have someone coming into your home to do, or go into the grocery store, learn how to order groceries on Instacart and all those things so that you do not have to leave your casa.
Thank you. Thank you. We have one more for tonight, and that is from, and I think that we've already touched on this, but let's go ahead and just reiterate this information. This is from, it looks like Shavara Oren, who asked the questions with limitations and extreme difficulty for those who can be tested. Please suggest the best options for those who believe that they're infected in regards to getting tested.
I'm on mute. Some of that's going to depend, Savara, on where you are, because everywhere is a little bit different. Maybe a little bit different in South Florida than it is here. Because basically, two of the locations, you had to have an order from your doctor or from a doctor, whether it be your personal physician, or they'd have you call do a televisit, and if the physician thought or provider thought that you met the criteria and they thought you need to be tested, they give you an order for it. There's also the option here in Jacksonville that I think at the stadium, that's where they were doing this, where if you wanted to get tested, you could get tested. It was just a fee of, I don't know if it was $35, $40 to get tested. So it kind of depends on where you are. But if you're concerned about, that you've been exposed to it, you're symptomatic, any questions, you definitely should want to talk to, your primary care doctor, and if you can't talk to one of them, try to get them to do a televisit or an urgent care, just so you can at least speak to someone about, your symptoms, and they can kind of direct you in, where to go get tested and how to go about that.
So, and actually, I'm not sure if I'm muted. So actually, and we're very fortunate here in Jacksonville. We actually do have numerous testing sites. And so what I can do is if there's an ability to post it onto the site, I can actually provide a list of all of the places that we have showing that they're testing. And so we can do that for you guys, but there are lots of testing sites in Jacksonville right now. But Lot J definitely is open every day. That's over by the stadium, near the Prime Osborne. If you go to Telescope Health, and I know I saw some news reports saying that that there was a fee associated with it. There's no longer a fee associated with it, so that you can also be tested over in Lot J. But there's Aventia. There's a lot of different opportunities. Now, if you're really having symptoms and you're worried about exposure, I would also recommend that you contact the 877 number provided by the health department, and they will guide you on specifically, what they feel you need to do when it comes to being tested. But there are going to be more restrictions and limitations on that. Millicent, though, if you'd like, I can provide you a list that you can post that shows kind of all of the testing sites. So there's definitely opportunities to be tested in Jacksonville, many, many, many opportunities. And so we'll make sure that's available to you. But great question, great question.
Well, thank you so much, doctors, for taking your time today to share some of your knowledge with our people, our family and friends here on Facebook. This is a wonderful use of your God-given gifts. So we appreciate the time and effort that you all have spent on this live session today. For our Facebook and family and friends who were not able to join us, please drop your question in the comments section, and we'll be sure to try to make sure that your questions are adequately answered and your concerns are addressed. And please continue to join us here at Millicent Daniels, aka the People's Attorney, Bats Daniels Law. Will continue to bring more information to you, the people, during this time of COVID. We don't want you to have to go out and be misinformed or look for anything. We're trying to serve as a resource to make sure that we have a central place to bring you the best, most efficient, accurate information as possible, which is here on our social media platform. Thank you for joining us tonight. God bless and Godspeed.
Thank you.
Thank you.